Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Hello, everyone, and welcome to the special edition of This Just In Radio. I'm your host, Justin Barnes. Today we're broadcasting live from HIMSS26 in sunny Las Vegas. Very excited to be here, and it's already been an action-packed 36-hour since I landed. This is actually my 12th year in a row broadcasting live from the HIMSS annual conference, and I am more excited than ever. Love this lineup. I'll get to it here in a moment as well. This is actually my 26th HIMSS annual conference, and I cannot imagine missing any of these at this juncture. Hal Wolf and the entire HIMSS team have been extremely supportive, and I'm so grateful. As most of my listeners know, HIMSS is a very special organization overall. And I want to take a moment, a quick note about this annual conference and the HIMSS Society in general. It can be everything that you want it to be. And I say that from the perspective that you will absolutely get out of HIMSS what you put into it. This goes relationships in general in life. But whatever you put in, you'll absolutely get out. And that's what I love about HIMSS and what it affords me. And I actually achieved my annual business goals early in the year because of HIMSS annual conference. This specific forum brings together tens of thousands of industry leaders and affords everyone that truly puts the effort in to achieve their goals. It is an 8-week frenzy for me and my team, but we'll host 3 live radio shows, host 3 large dinner events, co-host 4 receptions, and take in a very fun evening at the Sphere on Thursday. And even at this point in my career, as you know, Roberta, I'm still hustling. It's a lot of personal work and outreach to bring together 300 plus people over 4 days, but absolutely worth it. And a special note here also, HIMSS is powered by its members and chapters. They are the foundation that drives innovation, connection, and impact across healthcare. I highly encourage you, my listeners, to join your local chapter, get involved, and be part of the community shaping the future of health. And I want to also take a special moment here and note a thanks to my producer, Roberta Mullin, my co-producer, Jake Reed, my other producer, Greg Masters, for their support in helping produce these HIMSS broadcasts and recordings. They are always terrific, and I'm truly appreciative of the time they invest to make this show a success. For this specific broadcast series, though, I have a fantastic lineup of CEOs, CIOs, care providers, innovators, policy leaders, and visionaries. Here's a glimpse. Hal Wolf, President and CEO of HIMSS, Aneesh Chopra, we all know Aneesh, Rasu Shrestha from Advocate, Mariann Yeager, CEO of Sequoia Project, Dr. Erica Kim from ARPA, Simon Philip Roast from GE, Nelson Gomes from Medicus IT, Charles Barkey from West Virginia Medicine Hospitals, Richard Atkin, CEO of Greenway Health, Matthew Unangst from AMD, Leah Gabbert from Nutanix, and John Henderson from Rady Children's Health. And I have a couple other special guests joining here that will be broadcasting later. But as many of you know, you've been listening to the show for years. My goal is to create an information medium that shares best practices, strategies, and actionable intelligence from the industry's leading sources and experts. My goal, along with all my guests here, will be to offer tactics and strategies to not only survive, but thrive as you navigate your hospital, your physician practice, your company, or even your family through all these changes occurring across healthcare today. There is more opportunity than ever before for all of us to thrive, but we must understand how healthcare is evolving, how policy and reimbursement is shifting, and where best practice and innovation can support our efforts. I hope you glean all of that over the next few days. That's at least my goal. And now for my first guest, Roberta Mullin, Chief Editor, Answers Media, and Station Manager from Healthcare Now Radio, and my partner in crime for many, many years now. Welcome to the show. So grateful to have you here, Roberta, and thank you for having me.
Well, I'm so glad we're doing it live this year. We haven't done it in so many years actually live. And hi to all the people listening on the radio.
Absolutely. And I think most of my faithful listeners, you guys know, Roberta is actually responsible for starting this show back in 2014. It was her brainchild, and I could not be more grateful or happy that she pushed me for a year to bring my industry friends and peers on air for candid conversation. So, Roberta, thank you for pushing me, motivating me, naming this show This Just In, so I would take it seriously. But I owe a lot to you, so I'm grateful for all you did, and thank you.
Well, it's been a good partnership.
It absolutely has.
It has.
A ton of fun.
So let's talk a little bit about HIMSS. Mm-hmm. HIMSS, we were just kind of chuckling about the people that don't really know what the acronym means, but the HIMSS is HIMSS, right? Healthcare Information and Management System Society. Yeah,
but let's take a moment because please, if you ever email me, write me, talk to me, please don't call it HIMMS. Do you know how many times I see that? It absolutely means you don't know this industry, you don't know this society. It is HIMSS. Please know what the acronym stands for, but then also my other pet peeve is HIPAA. People go HIPPA, and oh my goodness, again, learn what HIPAA stands for. The acronym is HIPAA. Mm-hmm. So again, those are the little small things. How many times? I must have seen HIMMS 100 times in the last couple of weeks. People misspelling it and keep on sharing it. It's HIMSS. So I'm glad you brought it up, Roberta.
Well, acronyms are our business.
Acronyms are our business. Actually, Jake and I, another venture off air, we're talking to, kind of giving this person a little bit of a prep. They started work for one of our companies recently, and we apologize in advance. We have more acronyms than any other industry.
That's
and we
right.
kind of prepped her and said, hey, just be ready for it. We'll try to use less acronyms and spell these words fully out for you so you can kind of learn because they're coming from the outside in. But
we have a nice, what does it mean on healthitanswers.com. Go to the right sidebar and you'll see, what does this mean? And you go in there. We have hundreds of acronyms and every time a new rule comes out, we scan, because interestingly enough, when the rules come out and the proposed rules,
they perpetuate a lot. They create a lot of acronyms and they perpetuate a lot of acronyms.
Right. But they actually, that's part of the first thing.
Yes.
They have an index of the acronyms, and it's like, oh dear.
Yes.
Right. So HIMSS, you came in yesterday. I got in here Sunday, right. Yeah, I need a day to relax before we set up the studio.
Well, we left Sarasota, my producer and I left at 6 a.m., wheels up at 6 a.m. with an hour and a half layover, or an hour and a half delay in Atlanta, an hour layover, an hour and a half delay. We still made it in on time, and everything was very smooth, all the way from I will say the Venetian, they got us into the room early. That was awesome to drop our equipment off and then also get down and set up our equipment from one of our other broadcasts over here. But everything went extremely smoothly yesterday. I was praising the Lord, thanking Him. Because again, very smooth, clean, great day. Everybody's here. Everybody was reconfirmed for all the different shows. Even my guests here, I see walked in early, so everybody even found this broadcast early.
Right.
Because you and I, we go live.
Right.
And so that if someone doesn't show up on time,
we'll be talking. You'll be hearing us more.
You got it.
So, so first of all, HIMSS. I got a little history on HIMSS for us to talk about because it gives you trends. It gives you like where we've been for the last whatever. The very first HIMSS was in Baltimore, Maryland in 1962. That's a long time. We were only talking about mainframe computers. The big computer that had 10 megabytes of storage space that put the man on the moon. Did you know that? 10 megabytes. That's what it took.
I only know that because my elevator where I live has they actually had that sign up. I learned that like last week. I didn't even know that, but 10 megabytes.
Exactly. That's what we were talking about in 62. All right. Yep. So this would be the 64th conference, right?
It's my 26th though, but yes. Is it your 64th?
No.
Just kidding.
No. But I was born then.
I was not, but I'm more than most people.
I was born then, right?
That's awesome.
I was actually living in Keflavik, Iceland at the time.
Were you really?
So I was. I'm not kidding. You learn something new about me every time.
That's why I wake up every day.
Every time,
Love
right? All right, so let's talk about Healthcare Now Radio 2012 in Las Vegas.
Yes.
We launched Healthcare Now Radio. We actually turned the broadcast on, and we had, it was recorded. It wasn't live from here, but that's when we launched the radio and had all of our shows start playing. So that was all exciting. But I thought it was interesting that let's talk about the theme. We're talking about 2012.
Yes.
Customer and patient engagement in healthcare, especially in context with...
Well, EHRs, meaningful use stage 2, I think you were talking about.
Stage 2.
EHRs, yeah.
That's right,
yes,
correct.
Yes.
And the push for interoperability and data sharing. Okay, we were doing the push for
Love that. We were co-founding Commonwealth at the time and Care Equality at the same exact time, that year. Yeah, 2011, 2012, yeah.
And the EHRA?
EHR was founded in 2004. But we co-founded Commonwealth and Care Equality in around 2012.
And you're going to be talking to Mariann.
I am.
Yes, we're excited about that. We haven't seen her. She was your third guest on the show, on your show.
Third?
The third.
Wow, I didn't realize
she was the third guest on your show. So let's talk about the first time you did live.
2015.
2015, you were in Chicago?
Yes, thank you to my good friend Howard Bird, who was doing the Venture Forum at the time for HIMSS. And he had a wild hair. He said, Justin, you should broadcast your radio show live from HIMSS Venture Forum. And thankfully I did. Ended up turning I had no idea what I was doing. I ended up bringing a crew with me, and I did it 2.5 hours live on air out of nowhere, and it didn't miss a beat. I don't even know how that happened, but I was extremely fortunate. Great guest lineup. It was fun.
That the Radio X people? Because they
Stone,
fed
Peyton, and Lee.
Yes, because they gave us the feed, and we flipped it out too.
Got it.
So it was
I was just
all
telling
over,
Jake, singing their praises. If we ever go, I moved away from Atlanta, but I mean, if I ever go back there, they always had the most amazing studios for me anytime I wanted. They were great. They're fantastic to me, very supportive of us in our industry.
Well, tell them about our The Show Must Go On.
Oh my God! Let's talk about that too. I actually wrote that into my opening, but then I decided to cut it out because people don't want to talk about COVID. But in 2020, when we were canceled, basically, 4 or 5 days before we were supposed to go live with HIMSS, we ad-libbed. We said, you know what? We're still going to do a live broadcast. All my guests showed up. They dialed in from their homes.
And we went to the
cool.
studios.
And we went to the best Business Radio X studios and broadcast live. And again, all my guests showed up. Aneesh Chopra and Karen, Dr. Salvo and Hal Wolf. Everybody was.
Ruckers was the
Don
ONC
Rucker,
at that time.
Yes, he was. And I think we even had Mickey Tripathi then too, to be honest.
I think Karen Salvo. She had just started at Google.
She did, yeah. She joined us.
That was
really cool.
That was quite the lineup. Yeah, that was everybody you were going to talk to here, but then they canceled that.
They canceled HIMSS, but we did not get The Show Must Go On.
The Show Must Go On.
And so Business Radio X hosted that. Grateful for them.
So what about back to the 2015? Let's talk about the theme that was going on with HIMSS then.
Yeah.
Transforming health, harnessing IT, improving outcomes.
Yeah, love it.
Moving from, talking about like the systems and everything else.
Episodic care and really transitioning to outcomes and what we're achieving. All of this is still germane today. I mean, thankfully, it keeps us all employed. We're playing long ball here with all this, but we're seeing outcomes. We're going to talk about that a lot coming up with all my guests over the next couple of days this week. But we're generative AI, agentic AI is really helping us create these outcomes even more quickly, and having the care providers, having the CIOs and the CTOs talk about what best practices are being deployed, what outcomes are being seen by patients, how lives are getting better, how patients' lives are getting better, how clinician lives are getting better, how we're improving workflows in these organizations. They're saving money, they're saving lives, they're improving lives and the quality of life through using technology innovation. Some of it from interoperability, a lot of it from strategies internal to the health system. But very excited for what's coming up.
So when was your first HIMSS?
1997, and I did, because you asked me this off air, and I had to go research where was it. I was with HBO at the HBO and company at the time. I ended up merging with McKesson in late 99, 2000.
Right.
But
San Diego.
We were in San Diego. It was very cool.
What do you remember? One thing about that.
I was with Dr. Asaf Marag, who was a physician lead. We just bought his company called the Smart Medical Record. It was Pegasus. We bought it. It was one of the first EHRs in the industry. It competed with Dr. Mark Levitt, who was Medical Logic.
Right.
But what I remember is eating salmon with it head on for the first time in my life with Dr. Marag, with Asaf. He's still one of my very best friends. It was my one of my best men at my wedding, an entrepreneur I still work with at times today. But that's the thing I remember the most is having Ama Ebi, which head on sushi.
There you go. Mine was 2010. It was in Atlanta, and I was telling you this story that High Tech Act had just come out. Carol and I started High Tech Answers, and I went to Atlanta. I was living in Houston at the time, and I went to Atlanta twofold because I had to buy a house to move to Atlanta.
Right. I did too.
And so I went to there. I have to tell you, the thing that I remember about
I'm older than you though, so I did it in '96.
Oh yeah, right. Yeah.
Not 2010, but anyway.
Right. So. So the thing that I remember, I still to this day can't get over, is how large this conference is.
I know.
I was shocked. I mean, I was in the pharmacy business, and I would go to their
We were approaching
conferences.
we were probably 30,000, 28,000, 30,000 back then.
Under that, because they were in Atlanta still.
Okay, but we grew up to almost 40,000, 45,000.
That's when they couldn't go to any of those other places.
Yeah, they can only go to Vegas and Orlando for the longest time.
Exactly. This year, do you know what the theme is here this year?
I don't, but you do.
It's framed the epicenter of health innovation and transformation, emphasizing digital transformation, AI, interoperability, cybersecurity, and data-driven care.
Yes,
okay,
I love
so
that.
AI, of course. What are we going to see differently today than we did last HIMSS or last conference last week?
we are going to see where AI, certainly agentic AI, is making a tangible difference. We're seeing outcomes and how that is happening in our communities at every different size community. So whether you're a small practice, a large health system, you're going to see what AI is bringing for best practices. How it's being actually deployed is what you're going to see it, not just in a part of a strategy, but also success, patient outcomes, all of that. So that's what you're going to see here at HIMSS and certainly the rest of this year. So.
Mm-hmm. I think that AI, we've said it, it's one thing to have, years of us trying to figure out interoperability.
Yes.
This is just a different world with AI.
It is, and we're here. And I know my next guest is going to have a lot to say about this, and I'm very, very excited. So, again, real quickly for my audience, welcome back to This Just In Radio Show, broadcasting live from HIMSS26 in sunny Las Vegas. I'm very excited to introduce my next guest, a new friend of the show, Richard Atkin, CEO of Greenway Health. Welcome to the show, Richard.
Justin, thank you. Thank you for inviting me. I'm looking forward to sharing what we're doing here at Vegas and HIMSS. Very exciting time for Greenway.
Excellent. I know, and you may not know this, but Greenway is one of my alma maters. I was there from day one. I have a very strong affinity for the organization. I'm very happy that your team reached out. Very happy to be here with you today. Obviously, it's been a great couple of days since you've been here.
Yes, fabulous. Yeah, today we had a big announcement.
Yes.
For some months now, we've been working with our large customers on building a brand new platform. AI, generative AI, and agentic AI solutions. A unified workflow across the entire ambulatory practice. And so today was our big press release opening up for HIMSS.
I'm looking forward to learning more about it. So, first of all, Navarre is the product name? Is that
Navarre is the product name, yes. It's based on the Latin, means to renew or to reinvent.
I love it. Love it. So why this innovation and why now?
So the timing is great with AI. It's a seismic change. It's once in a generation opportunity. We began this journey at Greenway around about 6-7 months ago. The first thing we did was reformat or create a customer advisory board, saying, here's our vision. What do you want from this solution? How can we, using this technology, make your lives easier to deliver great patient care? And so it's really the circumstance, the timing, AI plus customer engagement plus the opportunity to really think differently about ambulatory practice and how it actually works and how it should work.
Right.
How we can move from clicks to care. The EHR was designed to be more of a data repository, not a solution that people can easily use. The user interface wasn't clear. And over time, with the regulatory requirements that got built on top, meaningful use, 21st century cures, HTI1, etc., it became more and more complex to use. So we decided we're going to reinvent that, rethink the workflows in a practice from a provider's perspective. And that's exactly what we've done, building out the Navarre platform.
Yeah, I love it. I mean, with the innovations and advancements we've had, certainly with AI and generative AI, you're ripe for these types of solutions. So how does your new Navarre solution differ from other agentic AI offerings in healthcare today?
Yeah, the way we think about it is that you can use AI to improve the efficiency of a process here or there, automate a process. But in a fragmented workflow, which is essentially what happens in an ambulatory practice, you got the front end, you got the encounter, you get the back end with RevCycle. You can make each of those fragmented elements a little more efficient, but that does not address the core fundamental problem. So our solution, Navarre, really rethinks that, as I said, end to end, sort of encounter to cache. And it makes the encounter itself with prompts and AI and agentic AI capabilities. It makes the issues associated with RevCycle cleaner and easier. So it doesn't push all of the issues downstream and into the evening hours for the providers. It deals with it upfront using AI prompts.
Yeah, I was actually just, I had a question offline a couple of days ago from one of my team members who said, what is pajama time? They saw that in one of the recording. We did a live show up in at Moffitt Cancer Center a couple of weeks ago, and one of the doctors talked about pajama time. And so I explained to him what pajama time is, and you just brought it up. Basically, all that documentation after hours.
Yeah, and so we have customers using the solution. Our early adopters are using it. They advised us on what it should look like, as I said already, but how to improve it, rapid innovation. But they've identified that they can save, each clinician can save up to 5 hours a day in the EHR. It also removes the EHR from being in front of the physician during the patient encounter. It actually improves the way that the physicians can interact with the patients themselves.
I love it. Congratulations. So kind of following up from a thought leader perspective, how do we keep healthcare human in an AI world?
Yeah, well, I actually think that AI enables healthcare to be more human. It takes care of so many things in the background. It takes some of the stress out. It provides the information for the physician at the point of care automatically, so the providers can focus on the patient. It enables us to be more human. It enables us to improve the communication and the customer and the patient interactions. So I think AI is the tool that will enable us to be more effective at human communication.
Yeah, I completely agree. It's a very good perspective. And I like how it obviously makes the clinician's life better, the patient's life better, higher quality of life for everybody involved. And we need that. We desperately need that in healthcare. We have so much burnout on the clinician side, even the patient side. So now we're starting to bring, this is what agentic AI can bring to us. So I love that you're enabling that further.
Yeah, some of the quotes that we've got from our early adopter physicians are, this solution enables the physician, to focus on the patient and do the things that they entered healthcare to do, to improve patient outcomes, to make good decisions for the patient and not have to worry about the technology that's happening in the background.
Yeah, and I think even building on that, I would say from your initial users and even from the this customer panel that you put together, what are some of the key functionalities that you say, hey, I think ambient listening one of the functionalities that I heard, but what are some key functionalities that you have inside the product?
Yeah, so ambient listening, I think that's getting pretty generic now, but yeah, so it's ambient listening, of course, but also we have search and summarization, so the physician will see a summary of the pertinent patient data, both prior to and during the encounter, during the consult. That's AI and generative AI. So search for the patient record, summarize it, bring forward the most important data. Pre-authorization, so that we can improve the revenue cycle and reduce denials. We also have AI-assisted coding. Of course, the physicians have to sign off on the coding, but it can bring forward both ICD-10 codes, the HCC coding, and really help the physicians both code and then get paid for the work that they're doing, serving the patient. So there are many capabilities, an AI-enabled revenue cycle, and we're building out the patient encounter functions too. So as I say, this full end-to-end workflow seamlessly in a unified platform.
Yeah, and I from a personal perspective, I love what you're doing because, again, I was with Greenway from the day one, and I truly love the customers. You guys have a very special group of customers. The people that you serve have been in healthcare for all the right reasons, and they have huge hearts. They work really hard. So the fact that you're bringing them this type of solution, I think is fantastic. They deserve it. So it's exciting.
Yes, indeed. Yeah, the customers, the patient is also critical in healthcare and often overlooked. That's obviously the reason that healthcare exists. Absolutely. Right? It's care and health, and I think the ambulatory sector has also been sort of overlooked. There's so much conversation about acute care, right? But of course, when you're involved in the acute care sector of healthcare, it's sort of failed already in a sense, because they're dealing with something pretty significant. The ambulatory area is where we all interact with healthcare most, and where we have the greatest opportunity to improve the health of patients and the communities.
Yeah, I love it. So my last question, we're getting to the end here. What must we get right over the next 3 years in healthcare? What's critical and what we must get right?
Yeah, I think that's a really important question. Obviously, we're an EHR company. We're sort of deep in the tech, and obviously we have to get that right. It's got to be confidence in the agents, in the AI, transparency, ethical use, avoidance of bias. So we've built a framework around that in the governance and the controls. So we have to get that right. To continuously build and improve on confidence that these solutions are providing the right prompts for the right decisions. But I think there's also something that we need to do to ensure that we sort of rebalance the regulatory with the performance or the purpose of healthcare and these solutions to improve the patient and the physician interactions and improve the outcomes, the health of the patients. And I feel like for nearly 20 years now with sort of meaningful use and the 21st Century Cures Act, etc.
Yes.
The focus has been on what data or what information the government feels is important, as opposed to the information that the providers really need to deliver excellent care and what is important to patients. So we have to get that balance right.
Fantastic. I love it. And I would say in our last piece, I'll give you a moment here. I have a lot of Greenway listeners that listen to my show just from my early days. What would you say to your customers right now that are looking at this type of a strategy and thinking about the future of healthcare? I'll give the platform to you for a minute or so. What would you say to them, to your customers?
So our vision is real. We've built a new platform, Novare. Come along, take a look and make an informed decision. But we're really excited about what we built, and I hope they will be too.
Yeah, I love it. Fantastic. Richard Atkin, CEO Greenway, I appreciate you taking the time to join this show, as always.
Thank you, Justin.
Thank you, my friend. Appreciate it.
I like that balancing the regulatory.
Absolutely.
Right? And it comes to mind something that you always are talking about, and it's about getting involved with commenting on rules. Right?
Yeah.
That's what he's saying. You know, he's saying don't let them do that. And you've talked about that for a long time.
Take a quick moment here because that's very, very true. Mm-hmm. We have to do our fair part in this industry, and that's certainly looking at these regulations. They affect us tremendously. They affect us as thought leaders, us as entrepreneurs, us as innovators, us as patients. Then also, and then the organizations that we serve actually affects them. So we need to look at this and take it seriously. We all have expertise. No matter where you are in this ecosystem, no matter where you are in this chain, you have expertise in your domain. And when you look at these regs, it's very important to share your ideas. I promise you, we know these people on Capitol Hill. They're good friends of the show too. They read every single comment. That's one thing I will say about Steve and the whole team. They read every single comment. Mm-hmm. So do take it seriously. Share, even if it's a small tidbit. Be positive, frame it in a very positive manner, in a constructive manner. But they will read it. They will take it deeply into their world and see how they can best fit policy. Our government, no matter who it is, Republicans, Democrats, do believe in public-private collaboration.
Right.
And we've been doing this now for over 20 years.
Right.
So it's a great framework to build off of. They know exactly how to do it well, and they can do it better by us engaging. Not always there waiting for a public forum,
right.
but when they have open comment periods, please take the time to comment on what's relevant to you. It makes a big difference in you personally will be shaping the future of healthcare.
Bottom line, when they propose a rule, read the rule, and see what you have to say about it.
Absolutely.
And comment. And it's so easy to comment now. They have portals, and you just say, it's not like you have to put it in an envelope and put a stamp on it anymore, right?
Very true. Very true. All right. Well, welcome back to This Justin Radio Show, broadcasting live from HIMSS26 in sunny Las Vegas. I'm very excited to introduce my next guest and new friend of the show, Matthew Unangst, Senior Director, AMD Enterprise Solutions. Welcome to the show, Matthew.
Hey, very, very, very excited to be here. It's an exciting week, and could not be happier to be here with you today.
It absolutely is. So before we dive into the questions, when'd you get in town? Anything fun?
Got in last night late, so haven't had a chance to go out and do too much yet, but busy morning so far, meeting with some partners, customers, and definitely looking forward to the next couple of days.
Fantastic. Where'd you fly in from?
Austin, Texas.
Austin. Is that where your home base is?
It is, yes.
It is. Well, AMD is a big operation there.
We do, yep.
Absolutely. AMD, they're always fantastic partners of the show. We love Tony Nunes and your whole team. Harini, you guys are fantastic. Dan Rivera, we love Dan. So the whole AMD team, they're fantastic. Good, again, supporters of the show, but great strategy in serving a great need in the industry. So kind of diving into the questions. These are hard. I love these, though.
That's all right. Let's do it.
Yeah. What is one bold move healthcare leaders need to make right now to optimize their organization?
Yeah, that is a a good question. I think there's a lot of options that could be on the table there. I think as we think about a technology perspective of that, not to overgeneralize it, but it's really around investing in AI right now.
It is,
and it's not for the sake of investing in AI just because that is the buzzword of the moment, but it's investing in AI to help solve the biggest problems that we have in front of us. I think the challenges that all of the partners in the entire ecosystem are trying to address: costs, better personalized healthcare, all of those types of things. AI is showing a lot of promise in those spaces. And so it's really about investing in AI with a focus on addressing the problems that each organization has in front of them.
Yeah, very smart. A lot of wisdom there, because a lot of the best practices that we share here is know what problem you're trying to solve, and also start small. Don't just get out there and say, oh, hey, we're going to deploy this. Look for a subset that might work best. And also, make sure you work your very best. Well, I think the best practice specifically are get a team together who knows this, who can understand what you need to achieve. Look for a care strategy that's kind of small before you do it. Industry, basically pilot it.
Yes.
And find a champion, someone who actually has deep respect inside the organization, because some of this can get hard. And so if you have a person respect inside the organization that can help you navigate all of this, do it from a pilot perspective, I think you're going to have a much greater success.
I think it's a really great point. I'm completely aligned with that. And you think about the value of a pilot. A, it's not as expensive as going whole hog into the whole thing from the outset. But B, it gives you the opportunity to demonstrate some quick wins and build some momentum, right?
Absolutely.
And so it helps internally in terms of building momentum. It can help, I'll say, mitigate some of the initial costs and challenges that a lot of organizations are struggling to figure out how they overcome in terms of getting into this AI world. So very aligned with that approach.
Yeah, and then also, even on the best practice side, is keeping the human in the loop. That's one of the pieces as well. And we'll talk about, so I'll kind of lead you off here, and I'll backfill some of that also from that strategy. What are you seeing as real measurable impact from digital health or AI? And again, not just pilots. We talked about that, which is really important where to start, but making real change in health systems or organizations.
Yeah, I think, when I think about that, I kind of group it into two categories. The one category is a little bit more around kind of traditional measures of value. But as we think about modernizing the data center, reducing operating costs, deploying technology that allows us to have, more persistent healthcare records and having those records follow the patient and all that kind of stuff. It allows us to do two things. One is it reduces the cost of operations. It reduces the cost of healthcare. Yeah. That's something we see with a lot of our customers right now, especially as they move to a lot of our AMD powered platforms. We're seeing those customers really see the value that is coming back to them from that sense. So it's a strong ROI from them on that standpoint. Mm-hmm. But the other piece that I think we're increasingly seeing is, real advancements in personalized medicine. The ability for us to bring healthcare to the patient as opposed to, the patient having to go find their healthcare. Healthcare can be a frustrating experience for a lot of patients.
It's a growing frustrating experience for a lot of patients.
It is, right? And so it's not like we've got, the silver bullet by any means, but I think some of this technology, we're starting to see bits and pieces around how we can make this better. The glass half full view of this, though, is I think there's a tremendous room for growth and opportunity ahead of us. I think way more opportunity ahead of us than what we've accomplished so far.
Yeah, and being around AMD and some of your team for many years now, and seeing how what you guys do specifically for health systems is by deploying your processors, you're actually reducing the cost and the operating expense for these organizations. And so what that does, that opens up budget for investing in AI even more quickly. So that's something critically important, because we have to get this right. Again, we talked about starting off in pilots, but then you've got to get out to community-wide adoption. You got to get an engagement and those kind of things. So you got to start somewhere.
Yeah, and the way we think about that is, yes, we design and build some of the best microprocessors and GPUs and all that kind of stuff in the world. But when it's all said and done, it's really about delivering solutions that deliver value.
Absolutely.
Right? And so we're making a strong effort and a big focus around partnering with the ecosystem, partnering with the lead ISVs, partnering with the healthcare systems that are out there, and making sure that our technology is really delivering value to all of those partners within the ecosystem.
Yep. And I know it's happening because I see it firsthand. So I want to say, congratulations.
Thank
you. Following this train of thought, how do we keep healthcare human in an AI world?
That's a good question. One that probably a lot of people have top of mind right now.
Absolutely.
To me, the way I think about that is you keep the patient at the center of the entire conversation, right? AI is an incredible tool. It has a lot of potential for re-envisioning the way we deliver healthcare. And you can keep a very personalized, approach to healthcare with AI if you keep your eye on what is most important, which is that patient. And at least that's the way I think about it. So if you keep the patient at the center of the whole conversation, a lot of these AI tools, the chatbots, the virtual assistants, the ability to do telemedicine, all that kind of stuff, I think that actually can and has great potential to deliver a better healthcare solution for a lot of customers. But it's on all of us to make sure that we don't lose sight of what the end goal is, which is delivering that value to the end patient.
Right. And I'm glad you said it that way also, because my previous guest had a very similar answer in a way. And when I created this question, I wasn't quite sure where it was going to go. But you guys, I think I love the theme that's coming out. It's AI almost ensures we keep healthcare more human because it's actually bringing a better experience, or actually better care. And you're bringing a better experience to care providers, better care, better experience to patients. And that's what AI can do. And so I kind of like this theme that's emerging. You're only the second person that I've asked this question of, so it's kind of cool. But I got it for all my guests, the next 20 guests or so. But I love the theme that it's running down, and I truly believe it, and I see it. So it's very, very cool. So next one's a pretty hard question too. What must we get right over the next 3 years in healthcare?
Yeah, that is a very important question. I think, as I think about it, one of the things that we must get right is making sure that we're more focused on outcome-based healthcare.
Love that.
Obviously, our systems around the world, they're all struggling with cost of healthcare. There's a lot of frustrations that patients have that we just talked about.
Absolutely.
So I think thinking through what that journey looks like for that patient and how do we drive more focus on outcome-based healthcare, I think that's what we have to get right. Now, how we go approach that, I don't know that we're always going to get it right. And so kind of the second part of my answer is around we have to try a lot of things and see what works and learn quickly and iterate. And we have to do that across all parts of the healthcare ecosystem and be willing to learn. And I think what you're going to see with a lot of the advancements in AI is just moving so quickly right now that we don't really know what's going to be possible 6 months or 9 months or let alone 2-3 years from now.
That's right.
So we have to all be willing to kind of try some things, experiment with it, see what works. Whatever works, we go with it and run with it. And what doesn't work, we say, it's okay, we tried it and move on. That's easy to say,
right?
But it's hard to do, right? Because you're talking about investments, you're talking about standing up projects that may or may not work,
right?
And so I think having kind of metrics around how we measure ourselves in those areas is going to be a really critical piece of that.
Yeah, I think it brings up a good point, and we kind of touched on this, and that's where the pilots also come into play. Is you can try these things, but we still have lives at risk. Now, you're not going to do a pilot with life is at risk, but you will do a pilot around financials. And hey, maybe we can't go save $2 million, but we can save $500,000. Well, that's a good trial. And we'll save $500,000 this year, but we'll save $2 million next year.
Yes.
And then I do know where Ochsner just saved $40 million by deploying AI in their revenue cycle. So those kind of things, are really important. And so that is the end game. But also, we talk about we must try and we must keep the towards focus more on outcomes, like the new access. And I don't want to put you on the spot for access, the regulation, but that's what I'm very excited about. Access. A lot of care providers are concerned about this new care model that was announced, only because they're afraid not enough reimbursement was tied to them to help them offset some of the costs of taking care of their patients. However, what you're going to see, and everybody will see in the coming year to 2 to 3 years when we start deploying these new care models that are truly reimbursing value-based care. We're using agentic AI. There's no way to be successful with this new AI, this new access model, without deploying AI in your care model, in your care strategy.
And that, to me, that's the fundamental point of this, is as you're thinking about your technology strategy as it pertains to healthcare, you've got to be thinking about how it applies to these types of evolutions and what's going on. And you've got to have a strategy around how to approach that, again, with the end goals in mind.
Yep, absolutely. And specifically around which you guys are working on, having that right infrastructure that is scalable, that can reduce your costs. What's really, we talk about increased costs a lot. We also have a significant push on reductions in reimbursement. We have, our financial models are being pressured down. However, we have to do more with less. That is what AI brings us. We have more. It is easier to deploy our care strategies in less expensive than ever before in some ways, because technology is getting less expensive.
Totally agree.
We're scalable. We can take care of more patients with less. So better innovation, more patients, less care providers, because that's just the economics of what's out there. However, this AI is allowing us to do that. It's allowing us to scale, give better care, more accurate information. That's all being sourced by technology, AI agents, generative AI. So it's extremely exciting. And this is not just what's on the wall and what's on a strategy on a roadmap. This is happening in our communities today.
Yep, absolutely.
So it's very, very cool. Well, Matthew, I'll give you the floor. We have another minute or so. What are you looking forward to accomplishing over your next couple of days here in Las Vegas?
Well, I'm super excited to be here to meet with a lot of our partners. When I come to a show like this, I think there's kind of two key things. One is you want to meet with your customers and your partners and understand what's going well for them and where there's opportunities to partner. But the other thing that's really important is to understand kind of the trends and where people are thinking in terms of the next wave of innovation and where they want to go invest and go explore.
Absolutely.
So that's really what I'm going to be focused on absorbing over the next couple of days.
Yeah, and I've seen you guys. I actually stopped by your booth. I was walking through, checking a lot of the booths. Jake and I were this morning before we came down here to record and broadcast. And you guys have a great location right off the main drag. You have a lot of partners running in and out of your booth right now. So it's kind of cool to see all that energy.
Yeah.
And we didn't even open the show floor, but a lot of these conversations happen even before the floor officially opens. So it's an exciting time here. Like I said, tens of thousands of thought leaders are here. Before you came on air, I talked a little bit about this specific show in general, the HIMSS annual conference. You can accomplish whatever your goals are here. Everybody's here. So as long as you put the pre-work in, you set up those meetings, anything that you want to achieve, you can achieve if you come here, if you put the work in, the effort in.
It's hard to beat the opportunity with everybody here to get that time.
Absolutely
Totally
true.
agree.
I mean, we've been working with, Tony and your team just from a strategy perspective for, 10, 12 weeks now, and it's gone extremely well. But we all put in the effort, all the hard work, the elbow grease. So HIMSS annual conference for 26 is going to be phenomenal. We will absolutely achieve our goals because of all that pre-work. And I say that because I want everybody. I came out of a conference 10 days ago in LA, and people are kind of griping, "Oh, I didn't quite do it." You didn't put the effort in. Then there were still 7,000 people there. And I achieved all of my goals while I was there because I put the effort in going before I went there. And you can't just show up and hope for the best. It's put all the heavy work in, do all those meetings, do all that outreach before you get here. So when you get here, you smooth everything through and you just kind of execute on everything. Again, everything is here. Tens and tens of thousands of people are here, and you can absolutely be successful. So
that's right.
Matthew, I'm glad you feel the same way, and it's great to meet you for the first time. I've actually never met you. So
yeah, no, I'm thrilled to be here, and again, I really appreciate the time and the opportunity to join you today.
You got it, my friend. Well, have a great rest of your conference, and be safe and have fun out there.
Sounds great. Thank you very much.
You got
appreciate
it. Thank you.
Bye.
Thank you, my friend. Appreciate it. Excellent. And I see Aneesh
Okay,
is here.
couple takeaways.
Yes, please.
Patient-centered care and outcomes.
Absolutely.
That's the key.
That's from your 2012, right?
Exactly.
HIMSS.
Exactly.
Let's bring him on in.
All right.
Everybody knows Aneesh Chopra. I don't even need to announce him, but I will.
What's up, my brother?
How you doing?
Greg, good to see you, my friend.
Excellent.
Thank you.
And for, uncomfortably close to the microphone, does that help you out, Greg?
Yes.
Yes, uncomfortably close.
Yeah, I got you.
Oh, yeah. No, Aneesh is a pro.
All right.
Awesome back. So welcome back to this Justin Radio Show, broadcasting live from HIMSS26 in sunny Las Vegas. I'm very, very, very excited to introduce my next guest and great friend of the show, Aneesh Chopra, author, innovator, former and first U.S. CTO, chair of Arcadia Institute, and great friend of Justin Barnes. Welcome back to the show, my friend.
Part of the brotherhood. Excited to have this opportunity.
Absolutely. As always, I assume when did you get in town? It's been a fun few days? Yesterday.
Yeah, very nice.
Awesome.
24 hours of awesome.
Yes, I know. I got about 4 a.m. yesterday. What time did you wake up yesterday?
Oh, that's okay. It's fine. Six is fine.
Okay. Yeah.
I'm not too early.
Well, because our flight, I had wheels up at 6 a.m. yesterday.
Yeah, it's not good.
Yeah, so no. But everything was very smooth. I'm grateful. Very, very happy. So I'm grateful that you were able to join us today. And I know we just met up in LA like 10 days ago.
Yes.
These are different
and the world
questions.
has changed.
It has changed. AI makes that happen.
Yeah.
No. So, and so does data and fire also. But also, what are bold moves today that healthcare leaders need to make to optimize their organization?
Well, the big takeaway coming out of Vive, and I think, the discussion that we're having right now, is whether or not AI will be inflationary to the overall system or deflationary.
Correct.
So the nightmare scenario, Justin, is you walk the halls and everybody says ROI, ROI. Mm-hmm. Well, in a fragmented, misaligned incentive world, ROI equals, one side wins, the other side loses. It's a win-lose.
Yeah.
So how does one make the case that there's global ROI where you can kind of have overall gains, but it's a win-win model? Like reducing waste, fraud, and abuse is one narrow example.
Yes.
So the tension is how does one gather the attention to pursue the strategies that are better for the system when we don't otherwise have the natural course of speed to do. That's hard. And I think that's why the role of government will play an important one. And you see a ton of activity by CMS, encouraging AI investments, asking for public comment, engaging with stakeholders at the FDA. So there's a regulatory welcome mat, but it's asking for AI that will be deflationary, not inflationary. By the way, not to filibuster on your simple question, but Chris Klomp, in the weeks we've since met, spoke publicly at the Better Medicare Alliance meeting, which is on YouTube. You can watch it. And he basically said, he's the senior, basically effectively chief operating officer of HHS, said, I am witnessing in the market more inflationary use cases, and I am actively going to kibosh. He shared an anecdote of an AI company that said, hey, I can squeeze 2 units of billing code within 15-minute increments, so can I use that billing code twice for my one use case? Because, and if you do that, I'm going to squash that code like a bug. I'm paraphrasing. So the access model, the model that is the CMS's explicit deflationary model, got away from CPT billing codes and went straight to, here's a fixed fee for outcomes. You get an upfront fee to sign them up and a pay for the results. And the number is so low, half the industry, if you walk the halls, like, oh, reimbursement is way too low.
I just talked about that last guest. I love this that you're talking about this. Yeah.
I would love to take everybody who's against the rates and put them in the inflationary bucket, and then everybody who's embracing the rates in the it's like the ultimate Harry Potter sorting hat. Right. You know, you got Slytherin, and you got whatever the winning whatever it was. What was he in again? He was, I forget what it was.
Well, so I'm going to filibuster myself because you brought me back to, I was testifying, I think, with Tommy Thompson back in 04, 05, something like that.
On a legend.
Right, but on waste, fraud, and abuse. Our numbers back, the Tommy used a number, Secretary Thompson at the time used the number $750 million of minimum waste, fraud, and abuse that they could identify back in, this is 22 years ago.
Of course.
What do you think that, I mean, your expertise, this is totally off topic. What do you think waste, fraud, and abuse is today?
Yeah, so let's break those 3 words. Waste, that's the heart of value-based care. That could be 20% of the spend.
Right, which is over $4 trillion.
Right, so just put $1 trillion in the waste bucket.
Wow.
Okay, Will Schrank put a number on it, so I'm not making my numbers.
There you go.
Will Schrank, our guru, kind of said, okay, waste. Fraud, with the open data we saw with the Medicaid spend, there's a lot of opportunity. ACOs are probably best positioned to be fraud detectors.
Absolutely.
Because they have an incentive to reduce it. Now, abuse, that gets to misaligned incentives.
That's right.
And so here, that's where you get the wound substitutes. It's legal,
right?
But icky, right? So abuse. So and you heard that Access Clinic is going to track that. So if you put all pieces together, we could be 20 to 25% total spend is in a bucket that someone should pursue that we get less of, and we would probably reinvest that not as savings to the system as a whole, but to reinvest in cell and gene therapies, better access, more primary care. And so it may still be in healthcare, but it may help to kind of be a virtuous cycle where we remove the waste, fraud, and abuse and reinvest for the greater good.
And these are annual numbers. So when you're talking about, we're talking about trillions and trillions of dollars annually.
At least the trillion. Let's just pay at least the trillion, so you win 1.5 trillion opportunity.
So this is extreme. I'd love to talk about it. I'm glad you brought it up. It's not part of my my questions, but I love this stuff. So what are you seeing as real measurable impact from digital health or AI? Not just pilots. I love the pilots, and there's best practice for there, but when real world change in health systems or in ecosystems.
Oh, absolutely. In every economic model we have, it's having an impact. So if you're in the fee-for-service system, boy, oh boy, it's upcoding up the yazoo.
Right.
So winning, more revenue. I say that with love.
I know,
I'm a fan of the ambient dictation. I'm an investor in some of the companies, so I respect it. But I do think that that's an issue. In the value-based care, it's really about the clinical decision support. So we have use cases even at Arcadia where at Intermountain, for example, they're embedding their clinical guidelines at the point of care in a computable format. So you can almost like have like a Google Maps route you towards the next best step in the clinical care guidelines. Like that's the greatest use case on planet Earth. You know, if Intermountain wants to not only have Word documents as panels and booklets of their guidelines, but computable at the point of care, that's amazing. And then on the consumer navigation front, I think in the last 10 days, the Claude bot revolution, what we're seeing is agents will start to take over the digital front door. And so if you ask the big question, we have insufficient ROI with humans trying to log into price transparency portals, separately provider directory portals, separately good faith estimate requests, separately quality portals, separately. So you go down the list, scheduling portals, and say, wait a minute, if we actually had an agent that could access all of that information, I could probably get access to the care I need that's better quality than what I think I'm getting now much sooner.
Yeah.
And that's what gives me excitement.
Yeah, and patients are ready for that. They want that. So people say, patients see now, certainly over the last couple of years, how AI agents are much more effective, efficient than an operator, someone answering the phone, having to go through phone trees and all that kind of stuff.
Yes.
These AI, we're becoming, as patients, much more aligned in this direction. So we deserve it too.
Yes, and back to your Georgia roots, Emory partnered with a firm I'm involved with called Guide Health.
Yep.
They did voice-bound AI calls
there you go.
to talk to people about their blood pressure.
Right.
And they say, hey, you're your doctor's AI.
Yep.
And I listened to a call that was like 6 minutes long.
That's awesome.
That explained that this, basically, get your blood pressure cuff and let's try it on. And it was absolutely democratizing to get people to get their information and share it with their doctor. It was great.
Love that.
That's
Great example.
my health system.
Is it really?
Emory's, yes.
Great. I love it.
And my doctor...
Julie is amazing, by the way, just for the record.
Julie?
An amazing CEO.
Yeah.
How do we keep healthcare human in an AI world?
Well, here you go. That's a very powerful question because AI itself may become human. So there's a whole separate question.
Yes.
But fundamentally, wouldn't you like it if someone knew more about you? If you imagine you called the help desk at your insurance company,
Absolutely.
and you're like, remind me your name, remind me your background, but instead it's like, oh, I know everything you're going through. You're in the middle of a chemotherapy episode. Yes, and I couldn't get my prior auth for the new regimen. I hear you.
Yeah.
I got you.
Yeah.
That makes that person's empathy on steroids because we've understood the shoes of the consumer or the patient.
That's right.
That's where AI can have the greatest impact on human touch. And you see it with ambient.
Yeah.
Physicians their eyes are on the patient.
Yeah.
They're not typing away in their on the computer. That's a great story.
Yeah. No, and so you're the third guest I've asked that question of, and I'm getting the exact same answers. Or following this great strategy here, or flow is all about the patient. So we really truly have the better patient care that's coming out using AI. And again, we're just in the piloting phase, and we're in the early days of this. So just wait. I mean, it's extremely exciting. So don't be afraid of this. Absolutely embrace it. And patients are.
Yes.
And so it's exciting to see. Before we dive into my last question, you mentioned Arcadia, because you don't actually mention Arcadia too often when we do shows. What is the Arcadia Institute? Because I noticed that your title changed. What is that? Let's give you
thank you.
30
Well, first of
seconds
all,
on
I'm
that.
grateful. Arcadia has sit as some sort of Switzerland between payers and providers to help move patients towards high-value care. And we built a pretty sizable network. Hundreds of health systems are using us, dozens of payers. And with that data set, there's a lot we could do to study the greater good.
Right.
And in combination with the Care Journey asset, which Arcadia acquired, which has the research rights to all of the CMS data, you combine the open government data with the data we have within our networks, and you could really understand, is the health system moving in the right direction or the wrong direction, and why?
Yeah.
So that part has been grateful. And so Michael Chernew at Harvard, Karen Joint-Maddox in St. Louis, Kevin Schulman at Stanford, Mark McClellan, these are friends of mine over the years who are guiding us to answer the best and brightest questions to unlock the value of the data that we built. And I'm grateful for the chance to be able to do that more directly as chair of the Institute.
Love it. Congratulations on that.
Thank you.
Before we get to the last question, I also want to bring up access, because I think you and I are among the only people that have come across that have a positive view on what, because we're also thinking down the road.
Absolutely.
So
we're going to look back in 5 years on this being a big existential moment.
So let's take 30 seconds now
Please.
to educate why access is important, why organizations should be taking this very seriously and looking at it, also looking at deploying it, but also what technology, innovation, and strategy should they be thinking about, because you cannot be successful without AI and agentic AI in the same model. So floor is yours.
Step one, we launched the Million Hearts campaign when the country was around 55% of patients with blood pressure elevated under control.
Yeah.
We're a decade and a half later.
Yes.
It's
Yeah.
still 55%.
Yeah.
So what
Exactly.
we're doing ain't working. So
Correct.
problem number
Love
one.
that.
Point number two, we have to move the productivity flywheel that gets to more outreach, more engagement, and at less cost. This flips the paradigm from, hey, we're going to add more billing codes, to, wait a minute, if you achieve the results by any means necessary within guardrails, you get to reward. So this puts the aligned incentives where they need to be. So we're going to turn the flywheel of innovation towards that outcome.
That's right.
And then third, and this is perhaps the most important thing, it turns out that the in-between visits are where you learn the signal that you should change the meds. You should adjust what you're doing. Think about a new arrangement. That signal is lost if you simply wait for the 3 to 4 month time period for the next doctor visit.
Great point.
And so we're going right at the in-between visit gap. So clinically, it's tackling the area that we know we have the greatest opportunity for improvement.
Yeah, I love it. Thank you for that, because I'm trying to get out there, but I don't want to go out there too far too fast. But I love talking about it. I want to keep it front and center. I want people engaging it, looking at what's best for them, but take it seriously. It's going to be a model that we're only going to build on them.
Absolutely.
So yeah. Final question, what must we get right over the next 3 years in healthcare?
Deflationary AI. Deflationary AI. We need the healthcare system to tilt. Now, I originally thought you could only do that with value-based care risk contracting.
Right.
Access gives us a little bit of more of a billing, more of a rapid-fire approach, which is not like total cost of care benchmarking. But there's probably another leg to stand on. The employer leg. If every employee had access to an AI agent that could get them to the best doctor at the lowest cost with the most available resource, and do that in a way that complements what they already have with their large PPO network, I think we're going to move towards a deflationary system. If everybody got the care at the best place at the right time, the cost would be cheaper.
Yes, it would. And their care would be better.
Yes.
Yeah. So
That's
better care, cheaper care.
True.
Yeah.
So we got to run the table on it without the noun of value-based care, but the verb, and go back to first principles.
I love it. Aneesh, you're always a fantastic guest.
you,
Love
sir.
the energy. Where are you off to? What's your next show? I think we talked about this a couple weeks ago, but Health Evolution?
Yes, I think Health Evolution is the best convening because all the CEOs are in the room, and you can get people to convene and take action, not just convene and educate. And I think that's a very powerful. It's David Brailer, who I love, the godfather of interoperability.
As the first person I ever testified before in Congress was Dr. David Brailer in 2004.
Amen.
First person. Actually, no, not before him. We did it for a committee. He was actually next to me because he had Missy Krasner with him. I think it was his staffer at the time. This is 2004.
Another sister. Rock star.
Yeah, Missy's awesome.
I love it.
We go way back. All right, my friend. Thank you so much, Aneesh. Have a great rest of your...
what Einstein says is the definition of insanity?
The same thing over and over again.
There you go.
Bless.
That's what I thought about.
Thank you. It is.
All right.
Awesome.
Awesome to see you guys.
Thank you, my
Cheers.
friend. Appreciate you, as always.
Thank you.
Thank you.
Have a good conference.
All right. Thank you, brother. Thank you. Love it. And I love how all my guests are on time. Aneesh is obviously always fantastic. Tons of energy.
I know.
Great visionary and also on time, which I'm grateful for him. Thank you, Aneesh. Now, though, we have a little bit of a breather before my next guest. But I love this theme of how do we keep healthcare human in an AI world. And everybody's bringing it right back to the patient.
Right.
How technology can bring us there. So this is fantastic. Oh, and I love my next guest is here. Fantastic. Come on in, Mariann.
Hi.
Love this. How are you?
I'm great. How are you?
Aneesh can join us. I love it.
We have a lot we can share.
Welcome back to This Just In Radio Show, broadcasting live from HIMSS26 in sunny Las Vegas. I'm very excited to introduce my next guest, and she was actually my third guest back in 2015.
Right, when you started the show.
That's right. A longtime friend of the show, Mariann Yeager, CEO of the Sequoia Project. Welcome to the show, Mariann.
Well, thank you, Justin. I'm so excited to be here.
So
it's been a while.
You got it. I'm glad you're here. You want a little bit closer to the microphone?
Okay.
Yeah, uncomfortably close, we love to say.
Okay.
So, I assume it's been a great couple of days. When did you get in town?
I got in town Sunday.
Awesome. Okay.
Yes, so plenty of time to explore and have great discussions yesterday.
Yeah.
So.
And obviously, when you're here through Wednesday, Thursday?
Wednesday, yeah.
Excellent.
Yes.
I know you're a much in demand person, so we're grateful to have you here in the industry and talking about some great stuff. I want to, before we dive into the questions, give my audience 30 seconds, because you've been on the show, I think, in 7 or 8 years or so. Dee Dee Davis joined us last year, but from your perspective, 30 seconds a minute on Sequoia Project and what you guys are doing in the industry today, and what you're achieving in the industry.
So Sequoia is kind of unique. We are a nonprofit with a public good mission, and we are solely focused on solving practical issues with respect to interoperability. We do so by bringing folks together from private sector, government, and they prioritize what we work on, and then we really roll up our sleeves and get to it. So a lot of the issues we're working on we could talk about, but then also folks often are very familiar with the work we also do with the government on TEFCA.
Absolutely. Very, very important work. I was fortunate enough to be on the board. I think it was in 2015 or 2016 I was on the board of Sequoia Project. So what is one bold move healthcare leaders need to get right now to optimize their organization, from your perspective?
I think leaning into interoperability is absolutely foundational. It's really going to be the power behind, really all the improvements in patient care, and will serve as the input to AI, and so it's really the enablement of really what everybody's been talking about at the conference so far.
Yeah, you really can't. Your AI will not be as strong or as powerful, robust without data.
Exactly,
So
and good data, and that's a lot.
Yeah, it's all about the data. Yes.
Yeah, and so a lot of times we talk about interoperability as moving data, getting it from one place to the next, and at the point in time you need it. But what we don't talk about as much is making sure that the data are usable, valuable, beneficial to the end user. Yeah. And so we actually have spent a lot of time and energy over the past several years on a data usability initiative. It's actually co-sponsored with the HIMA, and really coming up with practical guidance that vendors, networks, providers can implement to actually make sure that the data itself is usable even before it's ever moved. And it's kind of not a seemingly sleek, activity, but there's really nothing more important.
Well, there's two things there. So looking at the quality of the data, again, it will. It's a crass term, but I've been in data for so long, garbage in, garbage out.
Exactly.
So, and all AI does is make it faster. It makes the garbage pile faster. So having good, clean data, having access to it, but also making sure it's good data. Because again, your intelligence, your system is only good as good as that data. So critically keep that top of mind when you're rolling out. Look at these types of pilots, and certainly organizational wide is having access to the data. And you guys, Sequoia Project's one of the leaders of all time in unleashing data for our industry. So grateful for you. Before we dive on to the next question, what do you, as the CEO of Sequoia Project, what do you hope to accomplish in the coming days? I mean, it's obviously encouraging people to engage and take this seriously, but what are your personal goals for HIMSS being here?
For me, it's really about having in-person conversations that can get to a bit more depth than when you're virtual and you're sort of can't have as organic. I mean, we're human beings, right? We're sort of geared toward that. To me, that's what's so unique about HIMSS and this experience is having really the brain trust of healthcare and health IT and interoperability in one place. And really, I'm investing most of my time in talking with folks, like you, getting the word out, of course, but also really the thoughtful in-person discussions that you can just get to the heart of issues so much easier. Yeah,
good point. Actually, I've never brought that up before, but it's a good point because I encourage people to, engage HIMSS annual conference, engage the chapters locally, because that's where a lot of demonstrable change is happening. But what you brought up is a great point about being candid, because also you can have real candid conversations kind of when you're face-to-face and you're across the table. And certainly when I was the EHR Association, even as a leader in an organization, but trying to do a lot of the collaboration in the industry, it's hard work sometimes, and it steps on people's toes sometimes, and you can do that when you're face to face much easier than on a phone call or on a video chat.
Exactly, and really, interoperability only works if there is collaboration.
Right.
So it's really a central part of what we do in trying to bring folks together and work through really tricky issues, and sometimes they're kind of polarizing. Yeah. People are really passionate about it because,
very true.
What my experience, people in this space are very passionate about making progress. And that also means, you have to be able to work through really tricky issues as well. So.
Yeah. So speaking about fantastic people, how is Dee Dee Davis? Because we didn't have her on air. You're here, but how's Dee Dee doing?
She's amazing and sparkly as ever. So she's just effervescent. Really leading the charge on so many things for Sequoia. Particularly our data usability initiative is led by her.
Yeah.
And so,
no, she's special. You guys are very fortunate to have her.
We know.
It's very exciting. So where are you seeing real measurable impact in digital health or AI, not just in pilots, but real change in the organizations and in the ecosystem?
Well, I think I could speak most authoritatively about the progress with interoperability. And so, way back in the day when you were part of the Sequoia board, I would say interoperability and information exchange was in more of its infancy.
Right.
And so we've seen it as, becoming more turnkey, which is exciting. And so that means we're able to reach scale much more quickly and, really also expand beyond sharing information to treat patients, but also for public health. So instead of public health agencies having to do one-off connections, they tap into a national network framework, and all of a sudden electronic case reporting is taking off in an unprecedented way. And other purposes as well. Us as individuals need access to our own information. That's only available if you're able to tap into, again, a national network and framework. So that's maturing. I think we'll start seeing national level rollout probably starting in 2026 and seeing that put into practice, which is, I think, really powerful. I mean, you talk about patient empowerment, patient engagement, having a more ready access to our information, or for caregivers, you bet. I mean, that's going to be game-changing.
Absolutely. So actually, let's take a moment, talk about Sequoia's growth, because actually off air, before we came live, Roberta and I were talking about how many records have been exchanged and data. Can you talk about some of those stats of how you guys have grown over the last 10 years or so?
Oh, absolutely. Well,
Can I put something on top
please
of that?
do, yes.
The ONC came out with a report saying that with the 10 million last year versus the 465 million.
Exactly.
Is that a growth that you thought? Was it expected? Is it less? Are you ecstatic? Where are you when this report that came out?
Well, specific to TEFCA, I've seen in my experience that when you roll out interoperability capabilities for the first time, it usually is about a 2-year cycle. It's about a 2-year cycle to get networks connected, about a 2-year cycle to get early adopters, and another 2 years to get to scale. We saw that with care equality in the private sector, and that was the trajectory. With TEFCA, it's building on capabilities that exist, so we've seen that growth occur more in a more expedited fashion. Yeah. So I'm not surprised by that. I think
you're happy.
Yes.
You're happy with them? Okay.
Well,
okay.
more information exchange, the better. Then we're successful. Yeah. But, so we jumped 100 million documents in a single month up to 600 million.
There you go.
And we will see that hockey stick continue.
That's exciting. Congratulations.
Thank you.
So now bringing this back down to a little level here of how do we keep healthcare human in an AI world?
That is such a good question. I think AI is a tremendous tool, but it doesn't replace a clinician-patient relationship. AI is a tool that I could use as a patient to inform my own care, that of my children and care, family members. I just don't think there's any replacement for it. I think it's an incredible tool, but I don't think it'll ever replace the people side of patient care, as an example.
And I think, you're trending exactly with the answers. You're the fourth person that I've asked that question of, and it's really exciting to see. It comes back down to the patient, and we are keeping patients front and center. We're doing this all for the patient. And what you do specific was why I asked the question specifically of you also is you guys unleash data. And so you allow that information to flow. You allow our systems to make the best decisions for the patients, the best care quality. Mm-hmm. Hopefully, the guest before you is Aneesh Chopra. We're talking about deflationary cost of what we hope. We want AI and we want our overall models to bring deflationary costs to healthcare. We can't keep on rising all these costs. We have to bring some deflationary pressure, which we will. I think AI can make us more efficient. Having access to the right data at the right time can make us have better decisions, better care quality, better patient experience, all of that. And so I think that's where AI helps keep healthcare human in all this technology that's all around us.
Exactly.
So I love it. And you're right in the middle of it with what you're doing with interoperability.
Well, and also with one of the things that Sequoia realized is we talk so much about patient engagement and, patient access to information. And so we realized that we didn't really know or look at the issues solely through the lens of a patient that is not a health IT insider.
Right.
And so for the past several years, we've actually brought together a group of consumers and asked them what their experience was. Not surprising, there was a group of people, really no health IT background whatsoever, and they came from all walks of life, all different parts of the country, different socioeconomic backgrounds, and their shared experience was a really painful one, and not being able to get access to their information, not surprising.
Right.
And so we actually have continued that and released a toolkit to just look at how the steps that people have to go through to get access to their information, interoperability being a part of it, but even more from an experience.
No, I'm fortunate enough that I've had a private doctor in an ecosystem that's worked for me, but it's very difficult out there trying to access information. And you're a patient, it's gotten more difficult. We talk a lot about, we got excited about technology, innovation, and interoperability, because that's what we do for our lives, and we have a deep passion for it. But in actuality, we have a long way to go out there as consumers. And I think all of us have examples of how we help our loved ones navigate care, get access to the best care. We try to use our experience to navigate them the best that we can, give them best practices, or, hey, we've seen this work, or ask this question, because it is hard to get data and get it in real time and what we really tangible that we need as consumers and as patients. So we have a long way to go, a lot of opportunity there to improve. Last question, what must we get right over the next 3 years in healthcare from your perspective?
Again, it's through the lens of interoperability. I think what we have to get right is a shared understanding of what trust really means in in a highly automated information exchange ecosystem. And trust is tested, and we're seeing that. There is tremendous growth, and which is exciting, and there's an equal obligation to make sure that the right measures are in place. When I say trust, what I mean is it's not just about privacy considerations and making sure the data are secure, obviously that. Also, just making sure there are real accountability measures. In the early days of interoperability, there was a lot of goodwill. And there was a lot of homogeneity in the partners exchanging. You're either an HIE, a government agency, or a healthcare provider. And the world has changed. And to support innovation, of course, having access to data is key. So I think trust is going to be a central theme, and we have to get it right. We're really focused on that right now at Sequoia. In terms of looking at strategies informed by other sectors, believe it or not, other sectors have explored models where there is more centralized oversight and accountability, and we might need that for healthcare.
Yeah, I'm glad you brought that up, because coming off of another conference I was at a couple weeks ago, they said that trust is paramount in all of this. And obviously you're kind of front and center there with the Sequoia project around that, because you're not going to have people don't want that information if they don't trust it. And again, you're not talking about the security; they're talking about the trust of the data. So I'll even give you 30 seconds if you can talk about Sequoia Project's role in that, because that came up as an issue again 10 days ago out in LA at a conference about how we have to get trust right, because that will enable. And if you do, then we'll enable AI, the growth of AI at the right care at the right time, the right patient. But you've got to establish that trust and have that trust. So I'll give you 30 seconds in closing just about Sequoia Project and building that trust.
Yeah, I think our role is, we facilitate and bring people together to make sure we understand what the gaps are, what the needs are. And with our government work with TEFCA, naturally, we're working with ASDP as well. And there's a game plan there in terms of making sure there are greater assurances of who's actually party to exchange. Are they subject to the shared expectations for data use and disclosure? Are there measures in place to have oversight, monitoring, and enforcement? And we would serve an operational role for all of those things. Separate from our government work, Sequoia is really leaning into this issue. We've been working on what we believe are ideal pillars for trust, and again, drawing from other industry sectors. And the model in healthcare has major gaps that other sectors simply have filled through other models and approaches. So we're working on a strategy as we speak. We'll socialize it once we have our thoughts together. We think it's time to take a bold step forward and to step into a leadership role that we think people entrust us to take on, and we're ready, and we're going to do it.
Love it.
You just put out a report on the pillars, right?
You did. Yes.
Yeah, okay.
Yes.
Go to the Sequoia Project.
Yes. And we also do a lot of work on privacy and consent management,
Absolutely.
Data segmentation for privacy. Mm-hmm. Again, that's an issue that seems kind of esoteric, but it is foundational to make sure that we are evolving interoperability beyond the bits and bytes to something that truly engenders what patients expect and want. So.
Right.
If following that, if something near, I work a lot with health systems, but I also love the physician practices. But so where does the physician practice, say a standard 25 doctor group, 100 doctor group, how do they play with Sequoia Project and the exchanges? Because it's a lot of health systems, but tell me about how we've grown, maybe going down market to those other organizations as well.
Well, it has really been just a giant leap forward by having the vendors and service providers that, work with those smaller practices to get them to the table. And there's a role for all in TEFCA, in exchange, and, really leveraging the benefits of that. So really nobody should be left behind that has a legitimate need to share information for treatment purposes. The gap we also need to fill are assisted living facilities, long-term post-acute care, behavioral health, and there's a wide, circle of opportunity there that folks are coming to the table. They are joining, TEFCA and exchanging, and I think that's so exciting. It's not just for the large, well-resourced organizations. It's for everyone.
Congratulations.
Will you be bringing more QHENs on board?
We'll see. I don't know. We designated 11. Well, I don't know. I can't. There's people are expressing interest. I don't know if they're going to pass muster or not.
Right.
I don't.
Yeah.
We'll see.
Yeah.
Stay tuned.
Mariann Yeager, Sequoia Project. Thank you so much for taking the time to join us today.
Oh, well, thank you for having me.
As
it's
always.
Great seeing you all.
See you again.
All right,
It's a
bye,
true
guys.
pleasure. Thank you, Mariann. Bye. Excellent. I love it. I love interoperability. We need to unleash it, continue to in trusted frameworks.
Yeah, if you're really interested in Sequoia Project does monthly meetings, Mariann's on it, and she gives an update on that.
Yep.
Everything. They have a good report out on the pillars that she talked about. Sequoia Project.
.org, I believe
I
they are.
believe so.
I think they're
you keep me informed of what's happening there on
Yeah,
Kafka
that's
and all
my
that
beat.
kind of-
That's my beat.
I know.
The quest for interoperability.
I've
It's
had to
been my
dive into
beat
the
for
AI
like
world.
15
Perfect,
years.
thank you.
I know.
But I do love
You
that.
change with the wind.
Yeah, no. Wait, also the future.
Yeah, well, okay.
We have to
That's the
evolve.
wind. That's the wind, right?
Yes, well, it can be. Welcome back to This Justin Radio Show, broadcasting live. Let me keep us on track here, Roberta.
Okay, all right.
From HIMSS26 in sunny Las Vegas. I'm very excited to introduce my next guest and longtime friend of mine, Nelson Gomes, EVP of Growth Strategy and Partnerships at Medicus IT. Welcome to the show, Nelson.
Justin, thank you for having me. This is exciting.
It is. This has been a fun morning. It's great to see you. I saw you in LA a couple weeks ago.
Yeah.
And then you flew to what? You went to
Miami.
New York?
I was in Miami for the McDermott HPE conference.
Yeah.
Healthcare conference.
But you also went to Chicago, though, right after
yes,
LA.
I did. I'm like a world traveler. And
Exactly.
I'll be going to Orlando right after this.
Yeah, no, I know. That's why I wanted to have you on air. You're one of the most connected people that I know in the industry, in your hospitality. So he leaves LA, goes to Chicago, Miami, New York, back here to Vegas. Yeah, you're awesome, brother. It's great. I assume it's been an amazing few days for you.
Yeah, I mean, listen, it's always great to come to HIMSS. You know, it's an opportunity to spend some time with some of the partners, some of the innovators, some of the our clients that are here. So it's I love it because I'm a social butterfly, so this is perfect for me.
Right. Well, when we're starting the show, I was kind of singing the praises of what HIMSS annual conference, and I'd love your perspective. I know you're going to agree with it, but HIMSS annual conference and societies in general are what you make it. The effort that you put in, you'll absolutely get out. If you can't hit your goals here, it's on you. Because I do all this, I do 6, 8 weeks, 12 weeks of pre-work, prep work, setting up meetings, and all these dinners and co-hosting events, and it's all hustle, but we're in execution mode right now, but it's what you make it. So if you put the work in, the elbow grease in, you'll absolutely hit your goals.
I couldn't agree with you more. I think that, coming to this, you have to make most of the time that you're here. You have essentially 3 days.
Yeah.
To set up some time and effort to ensure that you're getting the most out of the show, whether it's through people that you want to connect with, whether it's new technology that you want to learn more about. Yeah. So it's about really scheduling your time efficiently and effectively, 100%.
That's right. It's putting forethought in. I think I will be meeting with almost 300 people while I'm here in 4.5 days.
Wow,
so
that has to be a record of some sort.
This is my record for sure. This is my busiest year of all time. I told Jake, this is literally my busiest I've ever been in my entire life. But it's great. I'm excited to be here. And we're executing well. So dive into the questions.
Sure.
What is one bold move healthcare leaders need to make right now to optimize their organization?
Well, there's so many things going on in healthcare IT today, but for me, I think they have to take a step back and stop chasing technology and start really demanding outcomes.
There you go.
So I think that's super important. We always look at adopting new technology. What can this new technology do? But ultimately, I think it's 3 things: clinical outcomes, operational efficiency, the patient journey, SaaS experience. How do you really make an impact that way? And let's think a little bit differently and focusing on those outcomes. I think that should be the bold move that leaders should be thinking about.
Love that. Great answer. Where are you seeing real measurable impact from digital health or AI, and not just in pilots, but also in out in the industry across the ecosystems?
So there's a few things. I think that the one thing that to consider is when it reduces friction for the clinicians, that's where I think the impact has to be.
Absolutely.
And the biggest impact that we're seeing is those organizations that are adopting ambient AI. And I will say this, ambient AI is not for all specialties, but I've seen it really impact in specialties such as, let's say, orthopedics has had a big impact. Independent groups that are really focusing on doing more with less.
Absolutely.
I think that you're seeing that. So that adoption has really impacted physicians, and more importantly, burnout. So now ambient AI has that ability to provide the patient, the physicians with the ability to kind of interact with that patient more, not worry about pajama time, right? And having to chart.
Third time on the show today,
right?
talk about pajama time. Absolutely.
And you're seeing like anywhere from 2 to 5 hours of time they get back, whether it's they wanted to play more golf, or whether it's time for, they want to see more patients. So I think ambient AI, for me, I think is having a big impact
Absolutely.
in the healthcare today, for sure.
Yeah, and I mean, to your point, the quality of life, we need to do more with less. Care providers need the break. Getting, the pajama time. I'd explain to one of my team members that they had, pajama time came up when I was doing a live show at Moffitt a couple weeks ago, and one of the doctors brought up how it's decreasing their pajama time by using AI.
Sure.
And then one of my employees said, what is pajama time? Because they'd never heard of it before. And I'm like, that's what most doctors do, and they have to go see other patients from 7 a.m. till 5 p.m. And then they might finish some charting, go home, eat dinner, cook dinner, stay with the family, and then at 8:30 at night they're doing charts again until 11 o'clock.
Here's a stat for you.
Yeah.
For every hour that a doctor spends with patients, you have any idea how much time they're spending on admin work and charting?
What do you know? What's the latest?
2 hours.
Yeah.
So for every hour of them spending time seeing a patient, they spend 2 hours documenting, doing some administrative tasks. We need to change that.
Absolutely. Yeah, that's not scalable. And we're also the trend of where we need to do more with less. We have less care providers, more patients. We have more complex care that needs to be deployed because we have more complex patients. And so this ecosystem can only be solved through technology, innovation, AI, Gen AI, all the stuff that we're talking about, AI agents. How do we keep, so feeding off of that, how do we keep healthcare human in an AI world?
And that's a question that I've been asked a lot lately. And I think it goes back to the friction, right? Mm-hmm. So how do you remove friction from creating distance between clinicians and patients? So having the ability to find a balance between both, I think, is super important. Surveys show that more than 60% of physicians cite administrative burden, just like we talked about, over driving burnout. It's tough. So I think you need to be able to balance both.
Very true.
Just using AI simply doesn't give you what you need. Just like if you want to use AI for dashboards, for complexity, or to provide that kind of information, are we really missing the mark?
Right.
Shouldn't we be focusing on the outcomes?
Absolutely.
And I think that's how you can balance it. You got to find that unique balance.
Yeah, and I think to that point, we brought this up with a couple of guests. A couple of my guests brought up this topic, and I did as well, proactively, around the new access care model. I'm not going to put you on the spot to talk about access, but access is exactly that. It's keeping the eye where we need to be down the road, moving to the right innovation, the right technology, the right payment models to where healthcare needs to evolve. It's pushing us in the right direction. It only can be achieved through agentic AI. There's a lot of worry and concern around that new access model, but absolutely, like I think Aneesh said it best, in 5 years people are going to look back and go, that was a change that we needed desperately to shift, to your point, into these new care models. We need to do it and go and keep technology front and center, but for the right reasons, not the wrong reasons, outcomes-based payments and outcomes, higher quality care for the patient. What must we, final question, then we'll go off to some fun, because I actually want to talk about our buddy Steve Rhodes a little bit too. Before we get to the personal stuff, what must we get right over the next 3 years?
I think there's three different areas that we need to focus on. And one of them is trust, which I think AI kind of plays.
Yeah, my last guest, we hit that hard on the last guest.
Yeah,
good point.
And I think the second one is security. And I think AI brings that complexity into cybersecurity and being able to protect patient data. And then I think the third one is accountability and digital health. Those are the three areas that I think we must have a focus on and do right as we move forward. I think if we have that focus, I think we're going to see a pretty major impact.
Yep. Absolutely.
Forward, for sure.
So your last point is accountability. So build on that a little bit. So accountability and health IT, or accountability and health IT was the last one?
So in accountability, so being accountable for like AI governance.
Absolutely.
So if you're going to adopt AI,
yes.
and we have clients that always come to us to say, oh, we need to get AI. And my first question is, why?
You're right.
Well, everybody else is
problem
using
solving,
it.
Right, yeah.
And that's not what you need to do. Is before you go to the problem, please explain to me, what are you trying to solve?
That's right.
What is it today that is one of those things that you wish you could do better, right? Or be able to take that burden off? And then before we even go down that path, let's look at governance first. Like before you go to this and adopt AI, what are the guardrails that you're putting together, not only for the systems that you're using, but the people that are using it?
Yep.
Recently, we did an assessment for a large client that was going through some challenges, and the question was asked during our assessment was, how much time does your team spend on AI, using AI? The response of the CIO was, not much at all. We ran reports, and when I tell you that the majority of the web traffic is AI driven because they're using different tools.
Right.
It's a perfect example. It's okay to use it. And I think we need to be able to communicate that more efficiently. Say, AI is important. It's going to be something that we're going to be used. But let's build some guardrails around it and how we're going to use it.
Yep.
And governance is a big piece of it. So if anybody gets out of my session today is, think about governance as you move forward.
Absolutely. I'm glad you brought that up because that's actually a really valid point. It's one of the best practices that I like to press on. I was at the HLTH conference late last year, and this was the first time I heard a great analogy by our good friends, Dr. Parikh, up in Kamal Jathwani, Dr. Jathwani, both from Moffitt, but leaders in AI in their own right, not just because of Moffitt, but they're also just great thought leaders in general around AI. Aneesh specifically, Dr. Parikh talked about how you need to look at this type of governance model as a precursor and a strategy overall, because you're going to have to walk into, you're going to be deploying AI across 5 different care models or 10 different systems, 15 different systems.
Absolutely.
You can't have a different AI governance model for each of those systems. You have to have one governance model for your organization and look at how you can integrate them all. So look at this holistically. Don't just go in there because he said you will wake up in 4 years from now and have 15 different AI governance models, which is actually untenable. So think about this proactively, put a strategy together, and then look at how you can attack this. To your point, your start-off point, what problem are you trying to solve?
100%.
Is AI right for it? Can it actually solve it? And then what governance model? And then how does it work with the governance model for our entire organization, not just for that ecosystem or just the episode that you're trying to solve for?
It's tough, Justin. I would tell you, I hate to say this, but it's very noisy today on AI.
It is.
And I think I had a partner come to me not too long ago, said to me, and he goes, "It gets overwhelming with all these AI tools that are out there. I don't know what to use. They all sound great.
Right.
Like, how do we go through that process?" So evaluation is part of it, is evaluating what tool fits best for you.
That's right.
And HIMSS is a perfect example. This is the opportunity to really dig deep and understand what are the AI tools that are out there, and how do they fit what you're trying to do.
And pressure test them to the best of your ability.
1,000%.
Yeah, and get and trusted partners, and that's the biggest piece here as we close is, and you're great, and it's why one of the reasons you're in that seat right now is because you are a trusted partner to a lot of people, and that's really important as we engage, and as people in the earshot of this, they engage these models and these strategies, is also who do you have as a trusted partner to navigate you through all of that. It's a great position that I've been fortunate to be in, and you're in too. So with that, Nelson Gomes, thank you so much, my good friend. Appreciate you joining us.
Thank you for having me. This was great. I love it. Thanks,
awesome.
everybody.
You're fantastic. Thank you, Nelson.
All right, I need to.
Now, thank you, everybody. Truly appreciate everybody joining us for this special episode. And please tune in weekdays as we always broadcast at 2:30 p.m. Eastern, 11:30 a.m. Pacific. Have a fantastic rest of your day, and thanks again.